everyone. I am Raquel Bertiz from the NLN Center for Innovation in Education Excellence. And today I'm very excited to chat with a fellow nurse educator and literally a fellow from our 2022 NLN Sim Lead Fellowship Program. And let me introduce Dr. Laura Klenke Borgman. She's currently the director of the University of Kansas School of Nursing Simulation Center, and she is a clinical associate professor of the same program as well. She had published and presented various works in nursing education, such as clinical judgment, nurse educator competencies, and currently also several projects on competency-based education. But I really admire Laura's passion and work in simulation education. More recently, the work that was acknowledged by the Clinical Simulation in Nursing Journal as Article of the Year in 2023 was that work on transferability of clinical judgments learned via simulations in the classroom to clinicals,
Yeah,
right?
that's right. The
Yes,
transferability of that to their actual clinical practice. That's
right.
right.
So there is so much to talk about in nursing education and simulations today, but I am very interested to learn, and I'm sure many of you are as well, our listeners, about initiatives in operationalizing competency-based education in curriculum and nursing programs, such as the one Laura and I will talk about today. So, Laura, welcome.
Thanks, Raquel. Always good to chat and catch up with you as my fellow.
Right? Yeah. So the nursing education has so many questions on how to implement competency-based education, and of course the 2021 AAC and essentials. So I would start with these questions. So, what projects or initiatives have you implemented in your nursing program, and what were your reasons for doing so? Well, other than we know it's the 2021
Yeah, other than we need to,
essentials
right?
that we need to do, right? Uh-huh.
Yeah, well, thank you so much. And like I said, I really appreciate being here. I could talk forever on these topics, as you know,
Right.
as well. Um, So, one of the things to your question that we really have been working on and implementing as a new initiative here at the university, the KU School of Nursing, is we did see the need to increase the presence of competency based education and competency based evaluation within our simulation curriculum. And again, like you said, all based on that 2021 AAC and Essentials, and saw specifically the sim zones approach as the perfect theoretical framework in which to do it. So last spring of 24, we implemented for the very first time in our curriculum, and specifically in our SIM curriculum, the SIM zones approach to competency-based evaluation through an OSCE, so an objective structured clinical examination for our third year students at the end of the semester, at the end of end of the year. Yeah.
So I hear Sim Zone's approach here, and many of our listeners may know it or may not know it, but I'm curious about it. So can you talk a little bit more about the Sim Zone's framework?
Yes, absolutely. So originally, the Sim Zones approach was published by Rusin and Weinstock. And then more recently, it's been kind of modified for specifically the nursing curriculum and education. And basically, it is a framework that we chose because when mapped together, sim zones, and actually, if people are familiar with Miller's pyramid of competency based evaluation, it's a
Mhm.
really strong scaffold for what authentic learning looks like, specifically in a longitudinal simulation curriculum. So basically, to evaluate what learners can do, not necessarily what educators teach them or tell them, right? So the SimZones system is an organization for longitudinal simulation-based learning, and it's comprised of basically 5 zones in which the authors talked about how there's specific learning goals in each zone. And as I mentioned, additionally, those zones were mapped to Miller's pyramid for competency assessment. So you start at the bottom of the pyramid or bottom of the sim zones, and you just worry about what your students know, right? Right. So basically, requisite knowledge. What do learners need to know from didactic courses, from their previous knowledge, from readings, to be able to then elevate them through the next zones? So zone 0, basically, of the sim zones talks about that, of just what requisite knowledge do they need to know. Then after they know, you kind of take it one step up into zone 1, and that's basically what they know how to do. So through the lens of sim zones and through the lens of sim, that's talking about things like repetitive deliberate practice of just like the psychomotor skills. So once they have that requisite knowledge in zone 0, you can move them through the next zone of repetitive deliberate practice. Then once they sort of have been in that zone for a while, you can move them to zone 2, which is more contextual learning. So now we can actually kind of start to throw them into simulation-based experiences because they have that other knowledge from the other zones. But you can still kind of stop and start them and provide feedback along the way. And that's kind of the contextual learning that happens in zone 2. In zone 3, that's what we think of the type of learning that happens in a simulation, where they start the simulation, they do the entire simulation, and then they stop and we debrief them. So there's not that stopping and starting. This is that traditional thing when you think of sim, stopping and it's not stopping until the simulation is over. And then the last zone, zone 4, is basically taking all of that knowledge that you've accumulated throughout those zones and being able to actually do in practice. And so this is actually like evaluation that would happen in the clinical practice setting in the wild, so to speak.
Mm-hmm.
So for this project that we did last spring, we specifically used principles of backward design through the lens of those sim zones that I just described to ensure that our curriculum met the desired outcomes for our students. So our focal point was that individual OSCE, a comprehensive evaluation that we used to assess the clinical competence of our learners, but worked backward from that through backward design throughout to create an entire semester-long curriculum that moved them through those sim zones to ensure that they were prepared to be successful in that end of semester OSCE.
Yeah, so there's a lot of elements of competency-based education to digest from what you just said here, right? So you definitely mentioned backward design, which is, of course, is almost synonymous with competency-based education, but I hear some elements there as well. So in terms of what you said about OSCE, so I'm thinking, formative assessments, summative evaluations, right? And of course, the simulations are teaching and learning modalities as well, right? So would you want to expound on how you did your, I would say, OSCEs, right?
Yeah.
OSCEs, what they were they for, and what came afterwards? Mm-hmm.
Yeah, absolutely, for sure. So to your point of talking about, we kind of covered the topic of backward design already, but I would like to kind of piggyback onto what you talked about regarding like formative and summative evaluation throughout this process. So as I mentioned, our initial step was kind of a thorough analysis of zone 0. Basically, we assessed our students' baseline knowledge and kind of did a preliminary analysis that revealed gaps, which kind of told us how to tailor our instructional sessions accordingly. And next, a curricular roadmap was essentially created that enabled our learners to achieve the necessary competencies that we wanted them to be able to do by that end of semester OSCE. So the roadmap basically included preparatory lab sessions that aligned with each sim zone framework zone for our learners. So, for example, we held an OSCE Prep Lab 1 toward the beginning of the semester that we sort of envisioned as being in that zone 1 of our sim zone. So that was held 1 month before the summit of OSCE, and it was a 2-hour session that incorporated some small group practice where students focused on deliberate practice of some of the psychomotor skills that were going to be required later in the semester in the OSCE. So specifically things like primary and secondary IV tubing setup, doing a physical assessment, doing ISBAR and a handoff, communicating with the healthcare team, doing safe IV medication administration. And in these 2-hour sessions that in this OSCE Prep Lab 1 in Zone 1, learners were able to do deliberate practice of those things and received real-time facilitator and peer feedback throughout that session. Then 2 weeks after OSCE Prep Lab 1, students returned back to the lab for what we refer to as OSCE Prep Lab 2. So again, we envisioned OSCE Prep Lab 2 occurring in that Zone 2 of the sim zones. So this time, this 2-hour session for the learners allowed them to engage in small group practice scenarios designed to mimic what the final OSCE simulation was going to look like. So students were allowed to kind of pause and stop and ask questions of the facilitators along the way. And again, that the simulation that they actually participated in was very close to the one they were going to do for their more summative evaluation, but it allowed them to stop and start and continue to get feedback. So again, that contextual learning in Sim Zone 2. And then what we referred to as Zone 3 involved the actual summative measurement of those nursing competencies through that individual simulation that each student did at the end of the semester for the actual OSCE. And every student took care basically of the same patient. It was a post-operative patient experiencing some post-op complications. So does that kind of answer your question about how we moved through those zones to prep them for that final evaluation?
Yeah, it makes sense, right? So if you have the Zim zones as your frame for moving your students through like maybe zero or no knowledge to eventually, at the end of this time frame, whatever that time frame was, they need to be able to do all of these things, which of course goes back to our prior conversation of backwards design, where, well, in the beginning, we need to know where they would be at the end of a certain time frame, which traditionally for many of us is a semester or a trimester, half a semester, whatever that is, right? So interesting. So and then I would like to circle back to your reasons or your aims for this pilot project.
Yeah. So essentially, we had 2 major aims for this pilot project. One, the first aim was to evaluate the individual clinical competencies of these third-year pre-licensure baccalaureate nursing students who were going to be in a primary nurse role while caring for this post-op patient. So we as the faculty involved created a faculty designed checklist where the students either did or did not complete observable tasks that we were going to be looking for and evaluating throughout that OSCE. And it was the expectation that the learners demonstrated competence for every line item on that evaluation checklist to be determined, quote unquote, competent in the OSCE itself. So to be clear, the final version of this checklist that we designed had 4 subscales. So really, we were looking specifically at behaviors that would fall into categories of patient safety, clinical judgment, physical assessment, and communication, with obviously required observable behaviors in each one of them. And so measurement, for every one of these students, they came in and did a 35-minute simulation caring for this patient, for which we measured then these competencies on this checklist. So, and this was the interesting part, Raquel. So performance was determined as either competent or developing competency. So to be in alignment and use that same language as the AACN is putting out for their competencies. And if students were deemed still developing competency, This was not a good, bad, pass, fail kind of evaluation. This was just, okay, great. You're still developing competency. So then if that was the case, they were brought back to the lab 1 week later for additional deliberate practice, and then did another summative OSCE. And this process, sort of an iterative process, was repeated on a weekly basis as many times as necessary until competency was reached for all of the learners. And in total, this process was completed over a 3-week time frame. So we were able to get 107 of our learners through this iterative process of, doing the OSCE, coming back if they were still developing competency, working with them a little bit more, and then having them do another OSCE. And it took 3 weeks. So not as long as maybe we thought it maybe would take.
But that's amazing, right? So,
Yeah.
and I hear the words like all students, and it's like
Yeah.
individual students. And I
Yeah.
also hear certain activities on the end of the faculty in terms of the creating the roadmap, designing the checklist, evaluation checklist, determining, I mean, behaviors.
Yes.
Um, that sounded a lot of work, and so
It
therefore.
was.
uh, and of course, like, oh, 3 weeks, right? Oh, were you able to do all of that in 3 weeks?
Yeah.
So I'm curious to know, how did you get this to work? So let's
Yeah.
your faculty, for example. I'm
Yeah.
curious about that. Yeah.
Sure, absolutely. So, 100%, it was a lot of work. And a lot of work to make sure that we did the process right from the very beginning, right? So that we were setting ourselves up to be successful all along the way. And we definitely gained valuable insight into not only the challenges that we as faculty faced, but challenges that student faced with competency-based evaluations along the way as well. So one of the things I will tell you is that very quickly in the process, the faculty recognized the importance of transparency regarding the evaluation process for our learners. So we made sure from the very beginning that we provided students with a really clear description of how evaluations would be conducted.
Mm-hmm.
We covered, that checklist that I just told you about that we designed. We covered the checklist criteria with the students from the beginning. I think a lot of us in education sometimes are a little worried about sort of quote unquote teaching to the test. But I think transparency and competency based evaluation is actually really, really important. And we were transparent with the students at the very beginning of the whole process. From the first day of one of those OSCE Prep Lab 1s, we provided the students the evaluation checklist that they were going to be evaluated on at the end. So they had that checklist through all of those prep labs and all of their learning, so that it was very transparent to them what they were going to be evaluated on and what competencies we were specifically looking at. We learned that was really important. We also provided timelines for feedback to students and reinforced that student data would be used to develop personalized learning plans for them. And this message was repeatedly communicated to students throughout the entire semester. So that's the one thing I can share with you, that we as faculty learned really quickly of how important transparency is all along the way for learners in this new methodology. The other thing we learned really quickly was, unlike traditional, like as I mentioned before, like unlike traditional pass fail or A through F grading systems, competency evaluations were a new concept for many students. You think about the way
Mm-hmm.
they've learned since kindergarten,
For
right?
sure.
Good, bad, pass, fail,
Uh-huh.
get a 97% on your test. This shift in assessment methodology was met with certainly a range of emotional responses from students.
I can imagine. Yeah.
And one of the ways we sort of came to know this was they also had to, once they were deemed competent in their evaluation, we had them watch the recording of themselves doing the OSCE and fill out a guided written reflection. And
Hmm.
in that written reflection, we heard a lot of comments from students, including stress, obviously, anxiety, uncertainty, with this type of evaluation process. Because as many times, even though we told them over and over again throughout this process, this is not good, bad, pass, fail. This is either you're competent or you're developing competency, and we'll bring you back. They still thought in their head when they were told on the day of evaluation that, okay, great, you're still developing competency. Several of them still thought as, oh, I failed. And that was a really hard hurdle to overcome with their level of sort of understanding of competency evaluation. And so that was really important to us as faculty as a learning piece as well. And so I'll say, despite the faculty's efforts to create a really supportive environment, many students still did equate developing competency as like receiving a poor letter grade. And that wasn't the case at all, right?
Mhm.
So that was one thing that's a big thing that we really learned moving forward, is how important that language is for this shift in methodology of how students will be evaluated.
Yeah, I can imagine if our students had gone through years and years of our traditional education, and suddenly
Right.
we're shifting them to this new way of, well, of course, evaluation is the biggest, I would say, component there. And I am used to getting a grade, like what you said,
Yeah.
or
Yeah.
or pass fail, and I can sleep at night knowing I passed. But then,
Right.
what do I do if you tell me I'm still developing competency? And of course, I can't imagine the cascade of activities that would happen afterwards to get to my competencies when I
Right.
get competence. But the first thing I would say is the acceptance of what do you mean I am not competent yet?
Right.
So
Right.
yeah. So I kind of like get what you're saying there in terms of, ooh, let's not forget our students here, right? Yeah, we're
Right.
all very excited about developing our roadmaps and curriculum. And yes, we have a nice, well-written program here, but what about our learners, right? But okay, so let's circle back to your faculty though. And I heard earlier that you said that the faculty understood the importance of this process. Uh,
Yeah.
so what about the learning curve of
Yeah.
faculty, if there is such, right?
Yeah. Yeah, no, absolutely. And I will definitely call out my team that I did this project with. They were fantastic. We were, always in tight communication. Communication and collaboration throughout this process was huge. And I think it's in beyond just your team of faculty, you have to think about the faculty at large as well,
Right,
right? And so,
right.
historically, OSCEs were oftentimes thought to be these very like high stakes pass or fail type of competency evaluations. And yet
Exactly, because that's what we went through,
that's right,
right?
right?
As
And so I
educators,
guess,
right?
my question to that and my little pushback to that is, do they have to be? Right?
Mhm.
To better capture the essence of competency based evaluation, I think we in nursing education should maybe consider reimagining, quote unquote, what an OSCE is, right? To
Mhm.
include iterative coaching and several opportunities for learner success, like the approach that we did in this project. And so I think that's one of the things for faculty development at large, not just
Right.
obviously here at my institution, but at large, is it'll also take a little bit of retraining the way we think about
Yeah.
some of the ways that we evaluate in the
Right,
past.
right.
Yeah.
And to our listeners, I would like to kind of like point out what you said in terms of transparency of learning and
Right.
how it goes in contrast to our traditional belief that we should not be teaching to the test,
Right.
which is why not, right?
Right.
And
Exactly.
why not? So if
Yeah.
we're testing them, we want them to be able to pass the test, but of course, not to take it literally to teach them what's in the test, but
Right.
what should we be thinking about as educators for our students to get there, successfully get there? And then of course, again, I'm not sure if this is the professional culture in nursing, and of course, I digress a little bit, but the anxiety and fear of learning, which occurs so often,
Yeah.
right?
Right.
So in our, I would say, roles as faculty and future faculty development initiatives, I think we should also be taking into consideration a kind of like reflection at our own culture as teachers, educators, and faculty. And I think that's a huge element of initiating any change, which we
Yeah.
often forget because we dive in right into, oh, this is what needs to be done. But like we leave ourselves alone for introspection, which is necessary. We would like to be conscious of our time boundaries here, and I know that this conversation can go on, and it will. We will end this part one now with the conversation of CBE and simulation-based education. Thank you for your time, and we hope to see you in our next episode. Bye for now, and see you in part two.